Hello, this is a short video about Spencer, who has type 1 diabetes. He needs insulin and also takes a pill to control his blood sugars. Spencer follows a daily routine for meals and injections. This routine keeps his blood sugar stable. Spencer starts off his day by pouring a sugar-free beverage so he can take his pill. Currently, the pill he takes is metformin. Normally, blood sugars are between 5 and 7 for most people. Spencer tests. And good number, Spencer. Oops. These are the components for his test kit. On your left is the pen that he uses to prick his finger. In the middle is a tub that holds his test strips. And on the right is the machine that displays his blood sugar level. Spencer loads the test strip into the machine before he pricks his finger. Then a little squeeze for a drop of blood. He dips this test strip on the drop of blood and waits for the machine to give a number. There is several types of insulin. Spencer takes 30/70 in the morning. This lasts on an average for 8 hours so that Spencer can have a normal day without injection until the evening. He still has to test before lunch. This is the syringe for insulin. Spencer takes 12 units in the morning. Spencer stores his insulin supply in the fridge. Insulin should not be exposed to certain temperatures. To administer insulin, inject to a fatty part of the body. Pinch so you do not hit the muscle, as insulin will not take effect. The ideal part would be the stomach area. This type of syringe is called a pen. The insulin is in the pen and you just dial in the units. A new needle is used for every injection. On to breakfast. Spencer likes to make pancakes on the weekends. These are a treat because they can be high in carbohydrates. Most foods now have a label with a list of nutrients. Carbohydrates are most important for diabetics. These turn into sugars in the body. Spencer has a certain amount for every meal. This, counting carbs, keeps his blood sugar stable. Too many carbs will bring the blood sugars higher than they should be. On the other hand, low readings can be even worse. Any sugars added to the food are combined with the total amount of carbohydrates. Other nutrients are important to monitor for everyone to ensure a healthy diet. This is a label on a diet beverage. Notice the 0 carbs and 0 sugars, but quite a bit of sodium. Water is always the healthiest. The Canada Food Guide has a lot of good information for eating healthy. A balanced diet of protein, carbs, fruit, and vegetables is important for everyone. Most proteins have none or very few carbs. Starches and pastas contain a lot of carbs, as do most desserts. Even some vegetables, such as carrots, contain some carbs. Spencer goes for blood work every 3 months to monitor his A1C level. This is usually followed by a doctor visit. The doctor will review his A1C level at that time. It is important to keep this level from going too high. Too high will cause health problems, including poor circulation and nerve damage. Looking at A1C is complex and best left to the doctor to monitor. He then can make the changes to medication if needed. Again, this number is best when it is around 7%. Physical activity is also very important for a diabetic to help burn carbs. Spencer enjoys walking, swimming, riding go-karts, and is excellent at bowling. Nice driving, Spencer. Swimming and going to the trampoline park are quick ways to burn carbs when his blood sugars are a bit high. Here's Spencer having fun on a trampoline with his friend. Spencer is happy-go-lucky, despite coping with diabetes. Spencer is happy-go-lucky, despite coping with diabetes. Hopefully, better treatments will continue to be discovered. This concludes our short video. All the best, Spencer.